Good morning and welcome back to White Mountains Today here on White Mountain TV 16. Joining us in the studio, Mary Jane and Lorie are here this morning. How are you today?
Good, thank you.
And we're going to talk about the Affordable Care Act, Affordable Health Care Act, and some opportunities that have that are opened up for those who perhaps didn't get a chance to get health care in the fall. So let's just start right off and talk about what you guys are. You're navigators.
Yes.
Right. And what we do is help people sign up for health insurance.
And that's an important thing. Now, the enrollment period has ended, but there's good news.
Right. There's a second chance for people that didn't have health insurance last year, found out that they owed a penalty when they did their taxes, have not as yet signed up for 2015, they have a second chance.
And when is that second chance enrollment period now?
Want to take that, Lorie?
It is until April 30th.
So they've got a full month now, and I'm sure the big question is, well, I don't know what I'm going to do. So that's why they come in and see you guys.
Right. We have done hundreds, if not thousands, of applications on the web. So we know how to get through the application, and we know something about the different plans, so we can help them choose. It's always their choice, but we can kind of give them the pros and cons of the different plans depending on their individual circumstances.
Now, are there a lot of different plans?
Yes, there are 35 to 40 depending on your age.
Wow.
Yeah.
That is a lot. That is a lot of plans.
It is a lot of plans.
Having a navigator, I'm sure, comes in handy.
It does. Most people choose the lower cost plans. They can go anywhere from $0 a month to over $1,000 a month.
Yeah.
And the people tend to choose either they're called bronze plans, is the lowest level, very low monthly premiums but high deductibles.
Yeah.
Or the silver plan, which is lower monthly premiums, but the deductibles are lower than what you, sometimes quite a bit lower than what you see in the bronze.
Yeah. And so like you say, you're just trying to match with what their income is or what they want to afford or what they feel their health care needs are.
Right.
So that's what's great about you guys. Now, how can people get a hold of you, and when are you there, and all that fun stuff? I know it's right here on this piece of paper, but you get to answer.
Okay. So we work at White Mountain Community Health Center, which is right down near the library in Conway.
Yep.
And we are there 9 to 4. So all they have to do is give us a call, and that's 447-8900, and anyone at the front desk can give them an appointment.
Yeah.
But we're having a special enrollment next Saturday, April 4th, and that's from 9 to 3. They can call ahead of time and get an appointment, or we will accept walk-ins too.
And how long does an appointment usually take? How long are people usually with you?
Well, we can allow up to an hour and a half.
Okay.
An hour to an hour and a half.
All right. So, but you make sure that people get the answers and are navigated correctly.
Right. If it's at the end of their appointment time and they still haven't been able to choose the right plan, they'll come back again.
Yeah. So you make it easy. You don't just like say, nope, not a time, you got to go. So.
A lot of them like to think about it.
Yeah.
Go home and talk it over with a spouse. And then they'll come back.
Yeah.
Prepared to choose.
Absolutely. So now we were talking about that a lot of people have found out about this. They're doing their tax returns, and all of a sudden they find out that they have to pay this penalty, which is one price this year, but it's going to go up. So it's one of those things you do really want to think about for next year.
Right. You want to tell how much it is this year
For
the tax penalty? How much people had to pay?
it's on average $95 per person, or 1% of your income.
Yeah.
And then it continues to go up every year if you don't have the coverage.
Yeah.
Right.
So it's really something you want to do. And I mean, because really, if you want to look at it logically, the money that you're going to spend for your penalty, you could put towards your health care.
Right. And some people choose plans that are $0. So how can they lose?
Right.
Even if your deductible's high, the fact that you still have the insurance paying nothing every month
Yeah.
would still work
in your favor.
Yes.
So.
Right.
And like you say, it is going to go up for next year. So what else? What else can we throw out and let people know? Oh, one thing I wanted to say is that obviously some of our viewers, they're watching, they're not from New Hampshire, but this is the navigators, or whatever they might be called in other states, are all over.
They are. And this open enrollment period is nationwide, so they can just go on the website, healthcare.gov, and there's a place that will say find local assisters, and they can find someone to help them.
Yeah, that's great. So that's a good thing to know. So if you're headed back, you can still say, hey, well, I can still get my insurance. So.
Right.
And can I also mention the special enrollment periods? Even
Absolutely.
after the deadline, there are still some household changes that can occur, or life changes such as getting married, getting divorced, having a baby, et cetera, et cetera. But you can sign up for that even after the enrollment period has ended if there is changing.
So if there's
Income
a life change,
changes.
income changes.
You know, you get a job, lose a job.
Well,
Anytime like that, you can still enroll.
Now, so obviously, healthcare.gov, the website is always there. But what about you guys? Are you there on a year-round basis to help people out?
We are.
We are
Our
there.
grant goes through September, I think. Yeah. So last year there was a brief period of maybe a month when our grant had ended and we hadn't started up again.
Yeah.
But pretty much we're there all year round.
And so you guys, and obviously by helping thousands of people, you're pretty well versed in the health plans.
We are.
We're learning stuff every day.
Right.
Learning new stuff.
They keep us informed. We have weekly newsletters and we're always having webinars.
Yeah. So always learning more about the Affordable
Right.
Health Care Act.
Right.
Well, that's great. So so as we wrap up here, what else do you want to throw out?
Lorie has some walk-in hours at the Conway Library.
Every Thursday from 2 to 4, I am there to answer any questions you may have about the Affordable Care Act. Anything, I'm always there 2 to 4 every Thursday,
That's perfect. So
unless otherwise noted.
so if anybody just wants, and then maybe they can set up an appointment from there.
Exactly.
And kind of go from there. So, and that's probably perfect if somebody is kind of trying to do some of the stuff online themselves. They may just have a simple
question.
Which has just held them up. I know we've all done that one. I was like, oh, if I only knew the answer to this, do I
Correct.
put one or two? So, well, terrific. And so again, so part of the White Mountain Community Health Center, you're down there, and the number again was
447-8900.
447-8900. Give them a call, and then speak with a navigator and set up an appointment and get some insurance.
That's right.
Well, that sounds great. Well, thank you so much, Mary Jane, Lorie, for coming
Thank
down
you.
today and talking with us. And don't forget to check that out, White Mountain Community Health Center, also the library.